everyone, I'm Sisy.
I'm Olivia.
And we are representing the Walter Payton HOSA chapter. And today we will be presenting about a national epidemic, the opioid crisis.
What are opioids? Opioids are drugs that are naturally found in the opium poppy plant that are made to relieve pain. Opioids can be in the form of prescription medications like Payton or oxytocin, or in the synthetic form like fentanyl, or they can be street drugs like heroin. Opioid drugs work by binding to proteins called opioid receptors on nerve cells in the nervous system. Some symptoms of opioid use includes pain relief and euphoria. They can also be very addictive. This picture here is basically showing the process of opioids attaching to the opioid receptors and natural endorphins attaching to the opioid receptors as well. As a person uses opioid drugs, the number of opioid receptors increases to a point where the natural endorphins can no longer stimulate them. There are many side effects of opioids in the body, which are natural opioids in the body, such as vascular constriction, constipation, and increased sensitivity to pain and heart disease.
Okay, so currently there are 1.7 million people suffering from opioid drug abuse. And every year we spend around $78.5 billion addressing this issue. So what is the opioid crisis? Well, in the 90s, there were more prescribed opioids, which led to greater risk of widespread addiction. And in 2017 alone, over 47,000 Americans died as a result of opioid drug abuse. This is a national public health crisis with major consequences, such as death, spread of infectious diseases, and neonatal abstinence syndrome. So we have some prevention measures. First, we need better access to treatment and recovery services. Second, we need to have stricter regulations on opioid prescriptions. As you can see in this map here, around 50% of all American states have limitations on prescriptions, while the other 50% do not. If we want to increase the amount of people that are not addicted, we need to impose limitations across the nation. Third, we need to promote the use of drugs that reverse the effect of opioid overdose and help treat addiction. These drugs are very effective, but they're widely underutilized. Less than half of all private-owned rehab centers offer this drug to patients, and around 1/3 of patients in rehab centers actually receive this potentially life-saving drug. Fourth, we need to provide safe and non-addictive chronic pain management strategies, such as surgery, spinal cord stimulation, nerve blocks, acupuncture, or physical therapy. Lastly, we need to provide a better public health surveillance across the country, which will paint a better understanding of the opioid epidemic, which will allow us to implement the strategies listed above in a more effective manner.
Opioids can be effective in managing pain if they're used properly. To help avoid side effects and the risk of addiction, you should use them only under a physician's supervision, specifically an anesthesiologist. Physician anesthesiologists, which are medical doctors who specialize in anesthesia, pain management, and critical care in medicine, have extensive training and experience in prescribing opioid and non-opioid pain medications. If you need help managing pain, a physician anesthesiologist can work with you to make sure your pain is under control while minimizing the side effects and the risk of addiction.
Thank you for listening, and these are our sources.